Friends, everybody is talking about irritable bowel syndrome or IBS these days. It is as if the incidence of IBS is rising day by day, and that is true. Lot of people and more people are getting IBS because of our lifestyle and our unhealthy eating habits. Today we are going to discuss this much common, much troublesome but entirely functional condition called irritable bowel syndrome. What are the causes of it and how to manage it? I am Dr. Prasad, Honap, consulting physician, and you are watching Let's Talk About Wellness. Irritable bowel syndrome is fairly common in India. According to one study, around 7% of the people suffer from irritable bowel syndrome or IBS. And unlike in the West, in India, it is equally common in men and women. It is a functional condition, which means if a doctor decides to have a look at your intestines from inside, he will not find any evidence of any damage or disease at all. Though it is a functional condition, it leads to significant morbidity, loss of productivity due to absenteeism, and economic loss to the society. It also affects the quality of life of the affected person. IBS is a group of symptoms which occur together. The prominent symptom being pain in abdomen, which is relieved by passing motion or passing gas. It is also associated with constipation or loose motions, that is diarrhea, or both. These people will also complain of bloating of the tummy, which is relieved by passing the flatus or gas. Why does one get irritable bowel syndrome? Well, we really don't know the exact reason why some people get IBS. It is possible that IBS is due to abnormal communication between gut and the brain. This may lead to either strong and vigorous contractions of gut muscles, leading to abdominal pain and loose motions, or if these contractions are slow and weak, this may lead to constipation. An episode of severe infection of the intestines, either due to bacteria or viruses, which is called as gastroenteritis, can also lead to IBS. Well, stress in the life, especially stressful situation in early life, can contribute to development of IBS. Changes in the population of bacteria and viruses which reside in our bowels normally and carry out various useful functions for us can lead to IBS. This happens when good bacteria are suppressed by bad bacteria due to unhealthy eating habits or unchecked use of antibiotics. Between the episodes of IBS, there are symptom-free intervals also. Stress, and in some people eating dairy, beans, cabbage, drinking of carbonated drinks or alcohol can trigger an episode of IBS. It has also been found that people who have family history of irritable bowel syndrome or those who lead a stressful life are more likely to get IBS. It is always good to a doctor when you develop symptoms the first time, especially if your first symptom is after age of 50. Commonly IBS develops between age of 30 to 50. So if you get symptoms for the first time after 50, it is better to seek medical advice. Number 2, the pain which is not relieved by passing motion or passing gas is another indication that you should go to a doctor. This is a functional disorder. There is no actual lesion or disease in the intestines. So if you lose weight or if you pass blood in the stools, you must seek medical advice. If the symptoms come during night, it is another indication that medical help must be sought. If you develop anemia and if you have family history of cancer of large bowel, then these symptoms must be investigated by a doctor at least once. Generally, your doctor will advise you to make amends with your lifestyle and diet. In severe cases, he may prescribe medication, as well as he may advise you to undergo colonoscopy, wherein he will have a look at your large bowel from inside. Before trying the medication, it will help if one tries other remedies. If you have noticed that a particular food item triggers IBS, then it is better to avoid that. Food items commonly implicated include wheat, dairy products, beans, cabbage, starch containing foods, alcohol, carbonated drinks, etc. Eating more green leafy vegetables, whole grains, unprocessed food, and drinking adequate water will always help you to relieve the symptoms of IBS. Consumptions of substances called as prebiotics or probiotics can also help by restoring the good bacteria in the gut. The foods which provide prebiotics are those substances that help the good bacteria to increase their population and thereby allow us to enjoy various health benefits such as healthy immune system, reduction in the risk of the heart disease and cancer, as well as control of weight. Addition of some food items give us plenty of prebiotics. These are soybeans, oats, bananas, tomatoes, berries, asparagus, garlic, onions, and whole wheat. The probiotics are actually substances which contain live bacteria, which are good for us. And foods which contain probiotics are curd, buttermilk, cheese, kimchi, and other fermented pickles. Physical activity can help in reducing stress and maintaining good GI function and may thereby ease some of the symptoms of IBS. Stress is a very common contributor to IBS. Stress management will be of tremendous help to a person with IBS. This includes, in addition to physical activity, techniques like meditation, relaxation techniques, and at times even help from a counselor or a psychiatrist can help. Friends, IBS is troublesome, very common, but should be managed without medicines as far as possible. I am sure these tips will help those of you who have IBS. Thank you very much.